So today we're going to look and talk and feel what exercise is during bladder cancer, after treatment, before treatments, and well into kind of survivorship. Everything that I do is evidence-based. So as an exercise physiologist, I'm not just telling you that exercise is good because I think it is. I'm using evidence-based to kind of form that information. So we need to start by talking about what exercise is and what it isn't, because a lot of people have the wrong idea. So exercise is any planned, structured, repetitive, and intentional movement done to improve or maintain one's physical health. So that's a little different to, oh, well, I do a lot of steps. Because steps and that kind of stuff is most likely just physical activity, which is a big umbrella. And if you go for a walk to get those steps, and that walk is intentional to improve your health, then that's exercise. So it's a little bit different than just any movement. And so let's feel what that is. So I want everybody to stand up. Tonight will be interactive, or at least for the next 15 minutes, all right? And I want you guys to march on the spot. So let's do some on-the-spot marching, swing the arms. Let's actually raise the arms up like this. Okay. So what we're doing right now, if we continue to do this for the next 14 and a half minutes, is aerobic exercise. We're going to get the heart pumping, right? You're going to be breathing a little heavier. For some of you, this will be quite hard. You're supposed to be marching, not just standing, just so everyone's aware. All right, now stay standing, but stop marching. And now I want you to use the chair behind you and to sit down into that chair and then stand up. And sit down into the chair and stand up and sit down and stand up. And keep doing that. So what we're doing right now is resistance training. We're doing a squat. I've tricked you into doing squats. Who knew that you do that tonight? Sit and stand. All right, you can stay seated. Phew. Okay, so resistance training is building muscle. And we don't need fancy equipment, although we can use fancy equipment to perform resistance training. And what you just did then, you did your aerobic training where you're marching and raising your arms, getting the heart pumping. And then we went into some muscle building resistance training, making those muscles stronger. And then finally some flexibility. So let's just reach up towards the ceiling, and then we're going to go down towards your left, and you'll feel something stretch out down this side and down through your arm. And let's go down to your right. Same thing on the other side. That's a really gentle, easy stretch that you could perform. All right, so that's flexibility training. So that's the differences, and I'll be talking about those tonight, mostly focusing on aerobic, or sometimes referred to as cardio, and resistance, sometimes referred to as strength. So how does exercise help? Why are we even having this conversation? We know that through cancer treatments, and even just through cancer itself, that there are many side effects. And those side effects impact your health, they impact your survival often, they impact your quality of life, they impact your well-being. Exercise can help build your bones. So any of the treatments that impact your bone health, or even just aging, as our bones kind of weaken, or we may be more at risk of osteoporosis, we know through specific exercise we can improve your bone health. We also know that we can improve your muscles. So again, just aging itself, we lose muscle mass. Throw in some treatments, whether that be a surgery, immunotherapy, chemotherapy, and we're going to start to waste away, you might call it, or lose muscle mass. If we drop below an imaginary line that we consider to be your functional threshold, you might have what we call frailty, which means that you're at a really high risk of falling, or having other comorbidities and having other bad health issues happen. We also know that exercise can help improve our heart. For many people, their biggest risk of death is actually heart disease. Okay, so if we're more worried about heart health versus bladder health, then we want to improve our heart health. And we know through both cardiovascular and resistance training, we can improve your heart health. We also want to help protect our brain. So some of these treatments may make you a little bit confused. They may impact your cognitive function, your memory, those kind of pieces. The evidence in this area is new and emerging, but what we think occurs through exercise is that we can improve your memory, that we can improve your cognitive function, but the evidence is still not solid there. So that's just a think thing at this point. It's not proven. And finally, your energy or vitality. We know that one of the biggest side effects of cancer and cancer treatments is fatigue. And whether that be fatigue, maybe it's caused by a depressive piece or a mood change. It could be caused through muscle loss or weakness. It could be caused through just a general feeling of lethargy, all right? Lots of different causes of fatigue. We know that exercise and consistent exercise can actually improve your energy and reduce fatigue. So that's what we're going to be talking about tonight. Now, what are the recommendations? These guidelines are new. They came out last week. They are international exercise and cancer guidelines that have been led by a local researcher, Dr. Kristen Campbell out of UBC. And what the old guidelines used to say was that anyone going through cancer treatment had to do what every adult had to do. Okay, so the same public health guidelines as all adults. And what we now know, because we have a very large body of evidence, is that that's potentially a bit much when you're going through treatment. And now the minimum that we recommend is 3 30-minute sessions of moderate intensity aerobic exercise. So that's the minimum you're aiming for. And then also 2 to 3 sessions per week where you're building muscle or doing resistance training. So that's your minimum target, and we're looking at this as the guide for when you're during treatment and building back straight after your treatments. When we look at your long-term goal, it is to meet those public health guidelines, and they are 150 minutes of moderate to vigorous exercise per week, so building up to 2.5 hours, and at least 2 strength building sessions per week. So basically adding in a little bit more aerobic exercise once you've gotten through your treatments. So what about intensity? I've said moderate intensity a little bit, and for many of you, what we did before where you're marching was probably moderate intensity. We can measure it through a talk test. We can measure it through you rating it yourself, or RPE, so rate of perceived exertion. Or we can measure it through actually measuring your heart rate. So in my clinic, I put heart rate monitors on people and we measure your heart because it doesn't really lie to us, okay? It can tell me exactly how hard you're working. In reality, at home, you don't have one of those, so we can look at how does it feel. So you can rate it out of 10, and a 4 to 6 out of 10 would be moderate, or you can try a talk test. So if you can talk, but you cannot sing, it's moderate. If you can sing, it's probably light and you need to work a little bit harder. And if you can't talk, it's probably too hard. So vigorous, you can still talk, but you can only say a few words. So keep that in mind when you're thinking, how hard is this intensity? And potentially walking up the stairs for you is something that is moderate or vigorous. It's probably not mild. Walking on a flat surface may be mild or maybe moderate, depending on your fitness. There's different ways that you can gauge this, and I want you to check in on your own walking and your own activity when you next do it and see how hard are you actually working. So try and sing a song. If you can sing a song, it's not moderate intensity, okay? So before we get into what exercise you can do specifically, I want to go through a few precautions, because we know that exercise is safe for the majority of people, but there are a few things I want you to know about. You may need to speak to your doctor or an exercise physiologist like myself before you start exercising if you have any of these things. So if you have low platelets, if you have low neutrophils, if you have low hemoglobin, if you're short of breath at rest. Short of breath when you're moving is normally okay. We expect that, all right? If you have low oxygen saturation in your blood, or SpO2, these are all reasons why we might want you to actually speak to someone like me or to your doctor before engaging in exercise. The reality is most people don't need to speak to anyone, and you actually just need to get up and start moving, okay? So don't walk away and think, I have to speak to my doctor. That is not the message. The message is for the majority of you, you can get up and do something straight away, so tomorrow you could start your new exercise routine. And then finally, with bone metastases, this is an area that I actually specialize in my private practice. We now know that you can exercise and exercise very safely if you have advanced cancer that has spread to your bones, but you probably need some guidance, and so you do need to have some type of supervision around what you're going to be doing. So why don't people with bladder cancer exercise? There's a lot of studies now into this, and we're starting to find out when we interview patients and understand what are your barriers, that a lot of people are unsure how to exercise if they have, say, a stoma bag, or mostly it's the treatment side effects, the fatigue, the nausea, okay, weight loss, pain, those kind of pieces can all impact your ability to exercise. People say that they're scared of being active after surgery. They're scared of the incontinence and of diarrhea. They're scared of falling, and they're scared of weakness. These kind of pieces are all reasons why you might not be exercising to the levels that we're encouraging you to be. And then in your community, there's probably a lack of social support, local exercise programs, home equipment. You might not have any, and you might think that you need it, which hopefully when you leave tonight, you'll realize that you don't. And then knowledge about what is safe and beneficial. So all that stuff on the right there, I'm going to try and change for you tonight. Okay, we're going to try and help you understand how you can get access to someone who can give you the right advice and how you can do exercise without any specific home equipment. We're going to go through treatment side effects and how you can overcome them. So we know that weakness is a big side effect, and it's often a side effect of inactivity. So treatments lead to you being in bed a lot or sitting down a lot. And if you don't do anything, you will lose your muscle. But it can come back. We can build it up. We know that if you're weak, we need to strengthen you. So doing squats and those kind of things is going to be really helpful. We know that with incontinence or urinary leakage, that we can actually improve that area in many people by doing Kegel exercises. Okay, and we can work with physiotherapy teams to actually help you understand what that looks like and feels like. If there's fatigue, we know that the most effective thing for you is aerobic and strength training. So we want you to do something when you're tired, which might seem a little counterintuitive. I spent the last 15 years helping people understand that when they're tired, they need to move more regularly. And that's often a bit of a battle, because you're like, but I'm tired, I can't even get out of bed. But we know from evidence now that moving is the best thing for you. If you're losing weight and you're worried that maybe exercising will cause you to lose more weight, we actually need to build strength so that you can function better and put on muscle mass. We want to put on good weight. And often when there's weight loss worries, we work closely with the dietitian to help you put that muscle mass and that good body mass back on. Pain normally needs regular exercise and movement to help reduce it. And if you're dealing with lots of joint pain, we may need to work with the physiotherapy team to ensure that you're getting the right kind of rehab. And depression is a big one, and I make sure this is on my slides because for a lot of people, the mental health challenges that they face just with the cancer diagnosis and with the side effects of their cancer and their cancer treatments, we really need to start addressing that. We now know from really good evidence that regular exercise, so aerobic and resistance training, is good, and that aerobic exercise seems to be best. Okay, so if you had to pick one, you'd pick walking or some type of aerobic exercise over just strengthening. And then poor quality of life. So quality of life is many things, and we know from all the studies that we've seen in exercise that regular aerobic and resistance training can help improve your quality of life. So it is a fact that being inactive will make your fatigue worse. Okay, we know that from so many studies that we've done now. And it's also a fact that exercise is the most effective way to reduce your fatigue, even more effective than pills. There was a fantastic study done in 2017 that put exercise up against a psychological intervention, up against pills. And they tried all of them on their own and all of them together. And what they ended up finding was that the most effective thing to reduce fatigue was actually exercise. Okay, so when you're tired, we need to find a way for you to move. And you might need guidance and instruction on how to do that appropriately. Because if you're getting lots of energy and you go and do everything and then you come crashing down and then you're in bed for 3 days and then you get energy back and you go and do everything and you come crashing down, you're probably doing it the wrong way, okay? The keys for fatigue is that you need to be regular. So don't be a 2-day-a-week exerciser, be a 4 to 7-day-a-week exerciser. We want to start with what you know how to do. So start with something like walking or whatever it is that you currently know how to do. And we want to build your volume daily. So 10 to 30 seconds is a way to build it. If you were at home and you were marching for 2 minutes, and then the next day you might do 2 minutes and 10 seconds, and the next day you do 2 minutes and 20 seconds, before you know, a month has passed and you've done 15 minutes. So it can add on really progressively as long as you're getting the right response. We don't go from 2 minutes to 10 minutes in one day because you might get a negative response and that might be too much for your body. And then finally, strength training. So we're going to go through a little strength program in just a moment. How do we enhance your physical function with exercise? So we know that exercise improves your strength. It can improve your fitness. It can improve your self-care, so your activities of daily living, and also your mobilization, so walking. I saw a lot of people here tonight look at these stairs and go, uh-oh, I don't want to sit up the back because that means I have to walk up 20 stairs and there's no handrail and I'm not sure I can get there without falling. But if you had been regularly strengthening your body, you would have seen the stairs and been like, yes, I'm going to go and get my steps in. Something to think about. Something I want to ask you guys just to ponder in your minds is what daily activities do you currently find difficult? Is it that getting out of a chair is hard? That could be a strength thing we need to address. Is it that getting dressed is hard? That might be a balance issue, right? Standing on one leg to put your underwear on. Lots of my clients tell me that that's a hard thing to do. Walking, especially if there's a bit of elevation or a bit of a hill, or even sometimes everything makes you short of breath, okay? Short of breath isn't bad. You can be a little breathless. For surgery, we can prepare your body for surgery, like Dr. So was talking about earlier tonight. So we can do prehab, where you get prepared for surgery. Post-surgery, we can do what we call rehab, and exercise has a place in both of these areas. So know that if you're going to have an upcoming surgery, that we can do something prior to or after it to help you recover. We also know that during and after chemotherapy, and even during and after immunotherapy, we can help to improve your overall function. We can reduce the side effects that you might face during those treatments, and we can help you kind of bounce back after treatment's finished. Finally, for overall health and living well, we can see from some of the evidence, and there is only a small amount of evidence specific to bladder cancer, but there's a lot of evidence specific to cancer. Higher levels of exercise seem to prevent people getting bladder cancer in the first place. There's higher survival in those who are doing more exercise. So one study showed 47% increase in survival for those who were exercising regularly. And living well, healthy weight, maintaining good muscle, regular exercise helps for all of those things. Some exercises for you to do at home. We did a chair squat tonight. We did marching on the spot. There's other things. You can easily Google these. You'll come up with a video and you'll see what that exercise is. Something you can start doing without any equipment at all. And then finally, the services that are available in BC. We have HealthLink BC. You can call 811. You can speak to an exercise physiologist like myself who has cancer-specific training on the telephone, and they'll give you free service for as much as you need their help. You can go to private clinics, kind of like the stuff that I do. There's some stuff we're starting at BC Cancer. There's group classes available at Inspire Health. There's stuff around locally. So come and chat to me after if you're interested to know what is there that you can access and where do you get it. And then finally, the summary. So what I want you to walk away with. Exercise can help you at all stages of bladder cancer, okay? From early diagnosis to late stage metastatic. Your amount that you're trying to aim for is 3 to 30 minutes of moderate intensity aerobic exercise per week and 2 or more resistance sessions. And the tip is regular, okay? Do it regularly, do a little bit every day. Aerobic and strength is needed. And your goal tomorrow is to get started. Thank you very much.